A very good morning to you once again. Welcome back to the Now Morning Show. Monday morning as we get ready to face another week of work, another week of school, or maybe your weekend was one of rest, relaxation, and these days, well, vaccination. We know the ministers this past weekend, they held their drives to encourage people to become vaccinated. This morning, we're chatting with our Caribbean neighbors over in Grenada, where despite vaccines being available since April, we understand that less than 20% of the population has been vaccinated. Now, let me paint the picture for you. We're talking about less than 200 cases in a year and a half to no active cases, and now averaging near 200 cases per day. A very grim and, dare I say, overwhelming situation over in Grenada. This morning, we welcome Miss Linda Straker, a freelance journalist, to our show. Miss Straker, good morning, and thank you for making the time to join us this morning.
Good morning. I'm happy to share development and information that is happening out in Grenada as we add to the COVID updates.
Great.
Because as you stated, it's a grim situation. The authorities has described it as dire, but we're hanging on.
Yeah. So did I get the figures correct? Are we talking about less than 20% of the population being vaccinated? Is that correct?
Well, yes, it is. Our population is 110,000. And as of yesterday, we would have only had, if I could just get the correct thing, I'll actually give you the correct number.
Sure.
The number of persons vaccinated right now is 29,351, which receiving first dose. And the second dose is 19,351. And with a population of 110,000, yes, it's somewhere between 20 to 23%.
Right.
But what I would point out to you that has been growing
Okay.
since we would have started the upsurge. Our upsurge started effectively somewhere around the middle of August, after we would have had a number of mass gathering events that happened what would have traditionally been the carnival weekend and week.
Right.
And which would have been the 8th to the 15th of August. And as from the 17th, that's when it was announced that we are having increased cases. So between then and now, we are now at 1,947 cases.
Right.
Active cases currently. What is the good news, though, that this weekend was our first no movement weekend, except for persons to get vaccinated or tested. Yesterday, the dashboard that came out last night showed that there were only 41 persons who new positive cases.
Okay.
Some people see that as a good sign, because what has happened, they're going into the communities now, because community spread was declared. And with people, volunteers and medical staff getting into the communities on the first weekend, and on one day you can only get 41, and people are going out and get tested. It starts painting a picture.
Right. And the uptake in terms of the vaccines, at this point, can you say whether there was a good uptake over this past weekend?
That data has not been revealed yet, but it is expected that most likely by the time the data come out later, it will show that we would have had a small increase. Because in the immediate of announcing and people realizing friends who were dying, I must say that within the past 2 weeks, we would have had but 26 deaths. The dashboard from yesterday said we have 27. Our first death was in January, and it stayed so until about 2 weeks ago. And it's in a short space of time, about 2 to 3 weeks, we would have had like 26 deaths. And so people knowing persons who have died, some people are young. We would have had somebody as young as 18, a child in the college. She should be around 18 years who would have passed. And so we have a mix of persons who would have passed. And that in itself has encouraged, it kind of spur people to go and get vaccinated. And at the same time, we would have had the choice now of the Pfizer vaccine.
Right.
Initially, you mentioned that we would have had vaccine from April. Actually, we had vaccine from February, but it was just the AstraZeneca. We would have gotten a donation from under the COVAX of Pfizer vaccine complements the United States. And from the time we would have gotten that has slowly increased our vaccine uptake. I am not certain because that data has not been revealed whether it is people are choosing Pfizer over AstraZeneca. But what is very clear is that we had over 5,000 persons taking vaccine within the past 3 weeks.
Good. So people are now accepting the harsh reality that is COVID. Now, for our viewers, you touched on it earlier, who may not have a fair idea of what took place in Grenada. So there was a ban on all carnival activities, carnival-related activities, and you mentioned that there was maybe one or several events that took place that seemed to be super spreaders. Tell us more about those events.
Yes, I will tell. But before we go back, I will also let you know that Grenada itself, we instituted 2-day quarantine for persons who are vaccinated way back since around May. And so some people are trying to use that, and I'll explain it a little lower, a little later. What has happened in last year to avoid the mass gathering because scientifically it has been proven that this virus spread with people. Grenada canceled carnival, and we would have had some people who defied and went out and jump jab, but nothing major happened. However, this year it was cancelled again,
Right.
and the people gathered in bigger numbers, mass numbers on the streets of certain towns, as well as we would have had a number of illegal gathering activities that the authorities described. They're not sanctioned because it was allowed for some events to happen with permission. So, for example, we would have had 2 shows where it was only allowed for vaccinated person. So these were legal in the eyes of the authority. But what apparently happened, there were a lot of, like our acting chief medical officer described it as house fit, yard fit,
Right.
backyard gathering,
Yeah.
a lot of those. And when the cases started coming up, they were all linked to some of those illegal gathering activities. So we would have had some of these illegal gathering activities, maybe in pools, people homes, and so. And then we would have had the big defiance on traditional carnival Monday and Tuesday morning. And since 2 weeks after that now, we are seeing that upsurge in cases.
Yes, yes, we
So
completely
that is
understand.
what
Oh,
it is felt would have responsible for our having community spread now. The
yeah.
defiance of people to just defy the authorities that there was no carnival, as well as the mass gathering for yard parties, pool parties, house parties, whatever. They all came together, and now we are in that situation.
That's the situation over in our neighboring Caribbean sister island of Grenada. Brothers and sisters, all the same in the Caribbean, because we are facing the same thing. We are in this COVID-19 pandemic. We send much love to all citizens of Grenada. Ms. Straker, we say thank you so much. I wish we could have chatted more. I wanted to find out about the proposal of this ethics committee, but maybe another time we'll find out a little bit more about that. Thank you for taking the time to join us here on TTT's Now Morning Show, all right? We wish you all the best.
Thank you. Most welcome.
So we're going to cut to break. When we come back, still lots more on the Now Morning Show. Don't move.